In the first few moments of life, it can feel like a race against time. And today, we're diving into a story about just that: how modern medicine steps in to protect a newborn from HIV, especially when the diagnosis comes at literally the most critical moment you can imagine.
So let's just imagine this for a second. The highest stakes you can think of. A baby is on the way, and right in the middle of labor, a test result comes back that changes, well, everything. What do the doctors do? What's even possible in that tiny, critical window of time?
Okay, so our story today centers on this 31-year-old woman. She's 37 weeks pregnant, so, just about ready to give birth. She shows up at a hospital in Spain, and here is the key detail, the thing that sets everything in motion. She's had zero medical care her entire pregnancy.
So she's admitted for something called preeclampsia, which is a really serious blood pressure issue. The doctors do what they always do. They run some routine blood tests, and that is when they find it: a positive result for HIV. I mean, talk about a diagnosis at the worst possible time.
And this, right here, is the heart of the emergency. The doctors have no clue what her viral load is. That's, the amount of HIV that's actually active in her system. Without that number, they have to assume the absolute worst-case scenario, which means the risk of passing the virus to her baby is as high as it gets.
Okay, so there is absolutely no time to waste. Every single second is crucial here. The medical team just flips a switch, going from a normal delivery to a full-on emergency protocol. And that protocol has one goal, and one goal only: stop the virus from getting to the baby. So the team launches this three-part attack. First up, an emergency C-section. This is to limit how much the baby's exposed to the mother's fluids. At the same time, they start the mom on an IV drip of a really powerful antiretroviral drug. And finally, they sound the alarm for the neonatal team, the baby doctors, so they are ready to jump into action the second that baby arrives. So you're probably wondering, what's this drug they're giving her? It's called zidovudine. You might hear it called AZT. The easiest way to picture it is like a protective shield. It just floods the mother's body, crosses over the placenta, and basically builds this wall that makes it super, super hard for the virus to get to the baby during birth. It's a total game changer. All right, so the baby is born. Now the focus completely shifts. Of course, the mother is still getting care, but for the newborn, those first 48 hours, they are this intense, super carefully planned mission to make absolutely sure the virus can't get a foothold. And this protocol is just incredibly precise. Right at birth, the first thing they do is give the baby a bath to wash away any of the mom's fluids. Then, and this is so important, within the first 6 hours, the baby gets its own dose of antiretroviral medicine. This is what we call prophylaxis. It's all about preventing an infection before it can even start. And then, at the 48-hour mark, it's time for the first HIV test.
Now, it's not a one-size-fits-all thing. A low-risk baby, say one whose mom was treated and has what's called an undetectable viral load, might just get one drug. But this baby is high risk. Why? Because the mom's status was a big question mark. So this baby gets a powerful cocktail of several different antiretroviral drugs, for the most aggressive defense they can mount. And so, after all that craziness, that tension, all that lightning-fast medical action, the first test result comes in. The baby is HIV negative. It worked. The whole thing, the C-section, the drugs for mom, the immediate treatment for the baby, it all came together to stop the transmission. You can just imagine the sigh of relief from everyone in that room. But this incredible case isn't just a one-off miracle. It's actually a perfect example of a much, much bigger public health success story. So let's kind of zoom out now and take a look at the bigger picture in Spain. So if you look at the data from Spain, over 80% of moms of HIV actually know their status before they even get pregnant. That's the best case scenario, right? Then you've got about 19.5% who are diagnosed during their regular prenatal checkups. But look at that tiny little slice at the end. Just 0.25% are diagnosed right at delivery. That's the group our story is about. It's super rare, but that's exactly who these emergency plans are designed for. And all of this work leads to something truly amazing. It's a huge win for public health. Because of all these protocols, the rate of HIV transmission from mother to child in Spain is less than 1%. Think about that. It's turned something that used to be almost a guarantee into something that's now incredibly rare. So how did they pull this off? Well, it's not just one thing.
First, a whopping 98% of pregnant women with HIV get antiretroviral therapy. And because of that, almost 90% of them get their viral load down to undetectable by the third trimester. That means the risk is basically zero. And for that small group who don't reach undetectable, the system is ready to go with C-sections and baby prophylaxis, just like in our story. But, no system is perfect. Even with all this amazing success, a big Spanish study found that 3 babies still contracted HIV. And since the goal is always zero, you have to ask, why? What went wrong in those cases? And this is probably the single most important point of this whole thing. In all 3 of those cases, there was one thing in common. The mother's viral load was still detectable when she gave birth. It just hammers home the point that getting the virus suppressed in the mother is the absolute foundation of all prevention. So that brings us to the main takeaway here. This whole story, from that one dramatic case in the delivery room all the way to the nationwide statistics, it all points to one really powerful idea: the huge, huge importance of prevention, and that starts with prenatal care. And the numbers really spell it out, don't they? If a mom has consistent prenatal care, her viral load is almost always undetectable, and that risk of transmission plummets to less than 1%. But without that care, the viral load is often high, and the risk just shoots up to 6.5%. The conclusion is, well, it's pretty obvious. Prenatal care literally saves lives. The authors of the study really said it best. After talking about all the success, they end with this really sobering reminder. They say, preventable infections continue to occur. It's a way of saying, hey, we have the tools, we have the knowledge, but we're not done yet. And that leaves us with one last really big question. The science is amazing, right? The medical protocols are clearly life-saving, but how do we get to the root of the problem? How do we build a system where everyone has the access and the support they need so that a diagnosis like this never, ever has to be a last-minute surprise?